I'm a clinical psychologist. I've been working in Oxleas since 2007, which is when I first qualified. I'd always had an interest in working with children and adolescents, even prior to my training, and then that just continued throughout my training. Greenwich is quite unique in that the ADHD team is a standalone team. In many other trusts, ADHD is managed by CAMS or the Community Paediatric Service. We do still have that arrangement in Greenwich, so CAMS will do the ADHD assessments for children that are under their care who are presenting with significant mental health needs. And the Community Paediatric team also see some children who are presenting with more complex medical or developmental needs. But our team see the majority, and we work very closely with CAMS and the Community Paediatric team. So CAMS will step down their children to us once they no longer require a CAMS service and just need ongoing support and monitoring for their ADHD. So we're moving towards becoming more of an integrated team. Prior to QbTest, our assessments tended to rely very much on information from school and parents. So we would use standardised questionnaires like the Connors. We would also send out some of our own questionnaires that we'd developed ourselves, which asked for sort of more qualitative information. So those assessments tended to be about an hour and a half to 2 hours long. They involved taking a detailed history from the family, also spending some time with the young person, getting some observations. The challenge that we had is being a small team. The numbers of referrals that we received well outstripped the capacity that we had, so we ended up with long wait lists. We actually found it really straightforward, and I think perhaps this was the one occasion where being a small team was advantageous. It's often easier to implement new things when you're not trying to manage lots and lots of people. But I think we'd spent a lot of time doing the groundwork, so there'd been lots of conversations with senior managers and the QB team and our sort of business office, so doing the sort of budget impact models and really setting that groundwork, so liaising with our information governance team, doing the DPIAs, and so a lot of that was already done, and then we'd spent time mapping out what the pathway would look like with the QbTest in it. So once we were sort of ready to go, it was pretty straightforward, and we used the sort of QI approach, so that sort of PDSA cycle. So initially just trying it with one child, testing how the process went, making any tweaks that needed to be made, and then just gradually scaling it up. And once we could see that the process was working really well, we just made it a standard part of our screening process. The PDSA cycles is one sort of approach to quality improvement. The P stands for plan, the D is for do, S for study, and then A for act. So the planning phase was where we spent time mapping out our pathways, identifying the problem, thinking about what the solution might look like. Then in the do stage, we tried it with one young person. And then we studied to see how did that go. Was there anything that we need to alter or adjust? And then the act is where you then do that, and then you repeat the process again, and you just kind of keep refining it until you've got something that is working, and then you either decide to adopt it or abandon it. And in this case, obviously, we decided to adopt. And then sort of scaled it up to the rest of the caseload. So prior to the QbTest, we had a wait time of around 2 years for an appointment with a member of the team. And we had to try to get some additional funding to sort of increase capacity in the team. Unfortunately, wasn't very successful with that, but we did have a little bit of resource. And initially our plan was to try and recruit either another psychologist or another consultant. But what we realised is that wouldn't have had a huge impact on the wait times, because the money that we had would have only bought us a little bit of a consultant or a little bit of a psychologist. But what we realised is that by using that money to fund for a healthcare assistant and the QbTest, that would have a much bigger impact in terms of getting through those assessments. So because the healthcare assistant is the one that is doing those QB tests, and that is really their primary role. They were able to do, you know, quite a high number every week. So we'd sort of worked out how many we needed to do a week to meet the current demand, but also clear the backlog. So that was really why that wait time came down so dramatically. But as I say, the wait for the first appointment now is about sort of 5 to 6 months. And they, as I say, they come in, they have that appointment, which is about 45 minutes long. And then we decide what is the next step. Are they going to have a shorter follow-up appointment or a longer one? So although it's now taking 2 appointments, still when you add up the time of those appointments, it's still shorter than it was previously. The feedback seems to be really positive. I think the parents really like that objectivity, and particularly the graphs, they're so visual, and it really does make a difference when you're in the assessment and you can sort of get the results up on the screen and really talk them through. And that often seems to be when the young people get really engaged and interested as well. They always want to sort of see how they did. So I think my sense is that it's kind of given a layer of confidence to the clinicians and the parents about the outcome. But also for teachers perhaps as well, we don't really get challenged on the outcome of an assessment, even when we've had cases where a parent is reporting lots of concerns and the school hasn't, but we've still given the diagnosis perhaps because the QB test was clearly indicative. You know, we haven't had a challenge from schools in those situations, whereas we were more likely to previously.